Also new tonight, we are turning to some health news. February is Heart Disease Awareness Month. And did you know women who experience pregnancy complications, including preeclampsia, gestational diabetes, are more likely to have long-term heart issues? This is a known issue, but there hasn't really been a lot of study into it. And that's something a University of Iowa associate professor is looking to change. We have Anna Stanowitz joining us right now here on The Current. Anna, thank you so much for being here with us today. What do we know about the links between pregnancy and chronic disease?
So we know that women who experience these adverse events in pregnancy, like preeclampsia, high blood pressure for the first time, or gestational diabetes, which is diabetes that comes on for the first time in pregnancy and then resolves after delivery, that these women, after they deliver, typically go back to looking clinically normal. Their blood pressures return to normal, their blood sugar control goes back to normal, and they have this window of time where they are pretty clinically indistinguishable from women that did not have complications in pregnancy. But we know that in spite of the fact that these symptoms resolve, they're at much higher risk for going on to develop chronic disease in the decades following.
What kind of chronic diseases are we talking about? Are they mostly with the heart?
Yeah, so all of these pregnancy complications are associated with a higher risk of cardiovascular diseases. Those can be heart diseases, diseases of the blood vessel. We also know that they're at higher risk for things like stroke and also kidney disease. With gestational diabetes specifically, those women are at really high risk for going on to developing type 2 diabetes. And then that diabetes often also contributes to a higher risk for cardiovascular disease.
Okay, well, this paints a pretty clear picture, but there's a lot we don't know. What are you still searching for when it comes to this link?
Yeah, so in our research, what we're trying to understand is what's happening in that window of time where these patients look clinically normal before they go on to have disease, so that we can understand what we might be able to do about it before they actually develop disease. For example, we know through some of our research that even though blood pressure returns to normal after pregnancy in women who develop high blood pressure for the first time in pregnancy, their blood vessels look a little bit different in that period of time after pregnancy. And so, what we're really interested in trying to know is what specifically is happening at the level of the blood vessel in that window of time so that we can intervene and improve blood vessel health before it progresses to disease. It's much easier to prevent disease if we know what's causing it than it is to treat disease once we've developed it.
Okay, so I can imagine, given that, it's super important to be very open with your doctor about pregnancy history.
Yeah, having one of these events in pregnancy is a major risk factor, and making sure that your primary care physician or whoever you see for clinical care knows about it is a really important part of discussing and managing chronic risk. There's a bit of a divide between what happens in pregnancy when we see specialized care around that pregnancy, and then what happens in the years and decades afterward, where we might be going back to a family physician or whoever we see for our normal care. Making sure that that person who's helping you manage your health care in that time after pregnancy, making sure that they know what happened during pregnancy is a really important part of a holistic image of what might be going on.
Okay, so what about if you do have a pregnancy complication? Is there anything you can do to take steps to improve your heart health?
Yeah, so just like anything else that's a risk factor for cardiovascular disease, we know that we can manage that risk with lifestyle changes. Sitting less, moving more, making sure that we're eating healthy, specifically reducing the amount of salt in our diet, and getting lots of rest, which I know is really hard for new parents, myself included, but trying to make sure that we're getting adequate sleep and good quality sleep are all important things that we can do now that help prevent the progression of disease. And that's true for women with a history of pregnancy complications, just like it's true for anyone else with a risk of disease.
So Anna, before I let you go, are there symptoms of heart disease that are easy to spot, or what should we be looking for?
Unfortunately, the number one thing that we should be looking for is high blood pressure. And that's something that's not easy to spot just by feeling like you have high blood pressure. But going to your doctor regularly, getting your cardiovascular risk factors checked, like your blood pressure, your blood cholesterol, and your blood sugar, is all a really important thing that we can do now to help understand what our progression toward disease might be looking like.
Anna, your research is fascinating and has really incredible implications for people all over the country and the world. Thank you so much for being here with us today.
Well, thank you so much for having me.
And if you guys at home want to share this story, you can find our online version up at WQAD.com underneath the As Seen on TV tab.